Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Cross River State government is not leaving any stone unturned in its bid to flatten the coronavirus curve as it takes samples and active case searches to border communities. Delta State government launches newborn screening equipment for treatment of sickle cell to cushion the plight of mothers and children with pre-existing medical conditions from the adverse effects of COVID-19. And countries in Europe come under strong wave of COVID-19 spread as Spain, France, Italy, Croatia and Switzerland record spikes in cases. We begin with the Nigeria Center for Disease Control (NCDC) announcing 221 COVID-19 cases in 19 states and the Federal Capital Territory. The cases are reported with Plateau State leading the cases with 60 there. The FCT is next with 33 cases. 26 were recorded in Kaduna, 18 in Rivers State. Lagos recorded 17 cases, one of its lowest. 9 in Enugu, 9 in Kwara, 9 as well in Ondo State, 6 in Nasarawa, 5 each in Gombe and Anambra State. 4 cases were recorded in Delta and Abia each, 3 in Imo, 2 in Edo, Ogun, 2 also in Oyo and Osun States. And Bauchi and Kano each recorded 1 cases. Now, these latest figures of COVID-19 from the center is one of the lowest in almost 12 weeks and slightly lower than the other figures recorded in the month of August, below the 300 mark. The total number of active cases went down for a second day by 99 to 11,730. After 317 people recovered, bringing the total number of those discharged to 40,281. In 24 hours, we lost 3 people to the virus, putting the total since the outbreak to 1,010, a reminder of the ravaging coronavirus. Now, the Murtala Mohammed International Airport is holding a pilot exercise ahead of international flight resumption on Saturday, 29th of August. A chartered flight to Paris, France is being used as a test for the COVID-19 protocols in place. The chartered flight has 93 departing passengers. The boarding protocol includes PCR COVID-19 tests. Let's go over to Cross River State, where the government has continued its sensitization and active case search exercise in the state to contain the spread of COVID-19. The Commissioner for Health, Dr. Betta Edu, led the state's task force team to Akamkpa local government area of the state, a border community between Nigeria and Cameroon, also identified as a potential hotspot. The visit, according to her, was geared towards sensitizing the entire staff, health workers of the local government area on preventive measures of the pandemic, its symptoms, as well as the need for everyone to take individual responsibility in protecting themselves against the virus. She stressed on the need for health workers across the area, the local government area, to serve as foot soldiers in the fight against COVID-19, as they are directly connected to the people at the grassroots.
We're here to do trainings and, of course, at the same time, solidify the linkage between the World Development Committee, the Rapid Response Team, and the local government task force in Akamkpa local government area. Akamkpa local government is a very strategic local government area in Cross River State. It borders Cameroon, and we need to work with the national security agencies to see that the borders remain completely shut and we don't have people coming into Cross River State from Cameroon. We're also working to pick up samples in the community to get them tested. And these samples, of course, would help us have a clearer picture of what is going on in this local government area. For now, the reception is good, and we're happy that the information is going out to the people, and we believe information is power. We've distributed a lot of face masks, hand sanitizers, and we believe they'll put it to judicious use.
Let's take you to Niger State now, where the government says it will not tolerate any act of sabotage in its efforts to curb the spread of COVID-19 in schools that have reopened for exiting classes. This follows the lack of compliance by some principals of secondary schools in the state to the safety measures put in place by the government. An intersectoral team led by the State Commissioner of Education, Mrs. Hannatu Saliu, have been going around schools to monitor the ongoing West African Examination Council's examination, observing with disappointment what it describes as an embarrassment in some schools that there was no compliance at all. The team notes that despite being trained and sensitized, many principals of secondary schools still fall short of the laid down COVID-19 protocols.
What we're seeing here today in one of our schools is there is no level of compliance at all. And in that sense, there is no spacing. The environment is not very good. In fact, on that, we have decided that the principal needs to be issued a query because this is a very critical phase. Government has invested heavily to try as much as possible to sensitize the principals on the dangers of this pandemic, the guidelines by the NCDC to be followed for school reopening, and also the state government went as far as even training some of their staff to be able to adhere to the rules and regulations of reopening school. It is not a satisfactory visit here in this school.
This determination to ensure that the health of our children are not put at risk by any inaction of a principal or school administrators. And I think basically we have prepared the ground. The state government have provided all that is required. The right sensitization have taken place. The appropriate training have been given. So there is no principal that you will have any excuse for not complying fully with the COVID guidelines.
Now, preventing the spread of COVID-19 in Delta State may have received a boost with the inauguration of a newborn screening equipment for the treatment of sickle cell in the state, being one of the underlying ailments that could worsen the health condition of any coronavirus patient. The state government took delivery of the equipment at the Sickle Cell Referral Center at Sabah Specialist Hospital, donated by initiative of the wife of the governor. With this development, Delta State has reportedly become the first state in Nigeria to have a newborn and adult screening machine in one system under high-performance liquid chemotherapy. The governor, Okowa, in his address expressed confidence that the use of the facilities will reduce the stress of mothers and, to a large extent, bring joy to families who are facing this challenge in the time of a pandemic.
It is in the best interest of this nation that we screen our children and that early enough we start to attend to them. Because a lot of them die, as Dr. Peace did say, within the first 6 months to 1 year. And that is because we are paid to recognize that they are suffering from sickle cell disorder, and we fail to attend to them, and they die needlessly. And that ought not to be.
Let's talk some more about flattening the curve of COVID-19. Joining us from our Abuja studio is Dr. Sofia Oh. She's a family physician. Thank you for joining us on the program.
Thanks for having me.
I'd like to begin first with the case range each day. Since Wednesday last week, does it give you a picture that we are winning this COVID-19 battle, or perhaps that testing is low while there is a rise in community transmission?
Okay, thank you very much. We can't really emphatically say we are winning the war against COVID-19 because it depends on the number of people tested. yes, we are trying our best, at least to an extent, but if you don't test a lot of the population or a lot of the people in the country, you can't be too sure you are getting the right values for statistics. So I think we are trying our best, but we need to do more. We need to ensure we keep checking, we keep testing people. In some of the rural areas, I'm sure the testing centers are fewer. So the number of people being tested in such areas may not be really much. So we need to make sure the testing facilities are being made available to different states, different villages, and different communities so that we can really know if we are doing well or not.
Let's look
and we know the war against COVID is ongoing. I know a lot of people have started relaxing in a way. Some people no longer use their face masks. Some don't even care about social distancing and all that. But we need to also know that apart from, if we want to win the war, we need to keep doing the right thing. Try to use our face masks, ensure social distancing, hand washing. It will go a long way. At the onset of COVID-19, we noticed a lot of patients, people no longer go to the hospital due to fear of being tested positive for COVID-19 or even fear of contracting the illness. But I think a lot of people have started going back to the hospital now for treatment of various disease conditions, which I think is a good one. And also, we need to emphasize more. I think we need to take this message to the rural areas, let them really know what is up, that there's COVID-19 virus infection and it's real, and they need to do all they can to ensure they protect themselves against contracting this virus. And apart from that, we also need to know that, we know health is wealth, as they say. We need to try and live healthy. We need to make sure we do exercises on our own, at least 30 minutes to an hour in a day for at least 5 times in a week. Need to eat healthy, try to ensure that fruits and vegetables are part of our diet, and ensure social distance, as I said, in preventing COVID-19. So effort needs to be put as individuals, and even the government needs to put more effort. We know at the onset of COVID-19, a lot of people, even up to now, a lot of people could no longer travel outside the country for medical care. So, which I think we should use that opportunity to make sure our healthcare system here is being put in order. So a lot of people can actually have come to the hospital. We can make the right diagnoses, having the right equipment to make the right diagnosis and proper treatment of patients. So it will go a long way. People should know that they need to do their best at this time. They should know that it's still ongoing. We can't really talk about all the rules and regulations that we've talked about has to be emphasized on. So that people
Let me just jump in
those
there, Dr. Joe, quickly. And this is looking at the FCT, and this is with regards to the number of cases. For example, we hear that Asokoro Isolation Center has closed down and hospitals are to start normal operations. But we're seeing that there are several cases. In fact, according to, what you have on your screen has a breakdown of the confirmed cases, the active cases, and those that have been discharged, also the deaths recorded from the FCT. We understand that the highest cases on admission in the country is with the FCT. That's at 3,561. Are you worried by some of these statistics that you're seeing coming from the FCT?
Well, it depends, because the reasons are not far-fetched. Because we have more testing centers in FCT compared to other states. So we need to, when you're testing more, you begin to get more cases. But when you test less, you get less cases. When you have more testing centers in a particular locality, you'll be able to at least get those ones that are positive detected. So I think that's where those figures are coming from. It has to do with the number of centers for testing. If you have just one center for testing in a state, you can compare it with a state that has maybe like 10 or 15 testing centers in which they can have a lot of persons tested in a day. So the reason is not far-fetched. But I think we should keep doing the right thing and we'll obtain the right results. So we should keep doing putting up the precautionary measures to ensure we don't contract this illness. That's the basic thing we need to do.
Indeed.
And also we need to increase the number of people we're testing so that we can emphatically say, okay, the rates are reducing over a particular period or not.
We'd like to thank you.
Really, we can now be so sure of what we're talking about.
Indeed. Thank you so much, Dr. Sofia Oh. She's a family physician. Thank you for joining us on the program. We have more on the global response to the pandemic when we return. Do stay with us. Welcome back. 2 new COVID-19 testing centers in Benue State will be ready for use next week. This is according to the Benue State Deputy Governor and Chairman of the State's Action Committee on COVID-19, who was speaking on the latest efforts by the Benue State government to contain the spread of COVID-19. Here's more from our correspondent, Pius Angbo.
It is good news for residents of Benue State as 2 new testing laboratories are about to be launched by the NCDC and the Benue State government to combat the issue of COVID-19 and increase testing capacity for the state. Currently, over 350 test cases are done every day from Abuja. But to change this trajectory, the Deputy Governor of Benue State, Mr. Benson Abonu, has said that the lab in FMC, Federal Medical Center, Makurdi, and the one at the Air Force Reference Hospital in Makurdi would be able to speed up testing for residents of Makurdi and expose how much the COVID pandemic is within the communities.
I think in Benue we are doing extremely well. We have stepped up our testing ability. Initially we were given a threshold of 200 people to be tested per day, and we were achieving that for quite a while. But in recent times, we've stepped it up slightly over 300 per day. And we believe that the more we test, the better. The only way to end this pandemic is to test virtually everybody. And those who have tested positive will be given adequate treatment so that they can be free of the infection.
From Makurdi, the Benue State capital, Pius Angbo for COVID-19 update.
Now, launching his latest policy brief on tourism, Secretary General of the United Nations, Antonio Guterres, pointed out that the industry employs 1 in every 10 people on Earth and provides livelihoods to hundreds of millions more. Strong data from the UN World Tourism Organization shows that 100 to 120 million direct tourism jobs are at risk, and the UN Conference on Trade and Development forecasts a loss of 1.5 to 2.8% of global GDP, describing tourism as an opportunity to experience the world's cultural and natural riches, bringing people closer to each other. We talked to a tourism consultant on what some might say is itself one of the wonders of the world. Mr. Lucky George, thank you for joining us. He joins us here in Lagos.
Thank you for having me.
Paint a picture as to how bad the tourism industry has been affected by COVID-19.
The travel and tourism industry is the worst hit. And let me just give you the scope of the travel and tourism industry. When we refer to the travel and tourism industry, we are talking of the airlines, the transport sectors, the hospitalities, the memorabilia industries, and of course, other related industries. So you can see the scope of the industry, and of course you can see how it has affected international airlines, local airlines, the hospitality industry, which is made up of the hotels and of course the restaurants and related establishments. Then we talked about the travel agents, the tour operators, and of course the other chains that has to do with the transportation, the land transportation, and of course the water transportation. So it's extensive and it's massive.
Now, the UN chief also talked about secondary impacts, such as the increase in poaching as people search for other sources of income during that period. Do you still see a future for the industry?
Oh, certainly, but I've done extensive study as far as the angle from which the international organizations always look at issues when it concerns Africa. You know, in a period like this that we're having a pandemic, they are talking of poaching. And here in Africa, we are talking of survival. So to us, who do we preserve the animals for where people are meant to eat? and survive. I think what is mostly affecting us in Africa here is the issue of the secondary industry. The secondary industry in this regards has to do with the farmers, the agricultural sector that nobody is talking about. I was part of a team that put together a document for the Federation of the Tourism Association of Nigeria, which is an umbrella body for all the industries in Nigeria. And one of the things we noticed was that about 34% of agricultural produce ends up in the hotel environment in Nigeria. So these are businesses that have been cut off completely. So this sector of our economy is almost grounded now. The farmers are not selling because the hotels are shut down. So to us, yeah, the concerns of the international organization sometimes might not be what actually affects us. And I've done a lot of research on this and a lot of writing on this, and I've looked at it that, yes, they have the right to look at that from their own angle, what concerns them, and based on who authored those documents. But for us in Africa here, it's extremely very important for us that we survive first. Just last 2 weeks, I had the chief executive of Zimbabwe Tourism Authority on one of my Zoom conferences, and I had people from Gambia and Ghana as well. And these are the things we talked about. So when they are looking at what we suffer, in terms of COVID, it's not the same thing that they suffer in the Western world. So for the UNWTO chief executive to talk about the issue of poaching and not really looking at what we are suffering here and how we have to survive, it's mind-boggling sometimes.
All right, we'd like to thank you so much. So I guess, it's a lot more efforts, and perhaps, Nigeria looking inwards and expanding its tourism potentials as well. We'd like to thank you, tourism consultant, Mr. Lucky George. Thank you for joining us on the program.
Thanks for having me.
Now, from France, Italy and Spain to Switzerland and Croatia, new infections are rising in what some fear is a resurgence of the pandemic in Europe, as governments try to manage the return to school. Meanwhile, Australia's Victoria state reports its lowest rise in cases in nearly 2 months. Here's more on the global update.
France has recorded 5,429 new cases in 24 hours, the highest number since the mass rollout of COVID-19 testing. Prime Minister Jean Castex says the state has its part to play, but everyone has to feel involved in fighting the pandemic. This latest figure brings its total number of confirmed cases to over 253,000. Spain's regional leaders are trying to coordinate the return to school with health and education officials as infections continue to rise, 3,594 in 24 hours. Madrid is the worst affected region, but Andalusia in the far south has recorded its highest figure of 846 cases since the month of March. South Korea has recorded 441 new coronavirus cases also in the past 24 hours, the highest single-day rise in new cases since the 7th of March. The Health Ministry says of these new cases, 434 were locally transmitted. More than 900 of the country's current cases have been linked to a cluster around the Sarang Jail Church in Seoul, the capital. And Australia's Victoria state reported its lowest one-day rise in new cases in nearly 2 months on Thursday, buoying hopes a lockdown of nearly 5 million people has contained the spread of the virus.
Take a look at our website, channelstv.com, for further updates on the pandemic. All you need to do is log on and you can access the stories. We have there Peru seeing volunteers for China's vaccine trials and so many more stories. That's channelstv.com. Thank you for watching the program this afternoon. I'm Millicent Nwaka. I'll be back again at 6 for another update. Stay safe.